The loss of public trust in the Centers for Disease Control and Prevention, CDC, is a crisis that demands urgent attention. And Robert F. Kennedy, Jr., the Secretary of Health and Human Services, is stepping forward with a bold plan to fix it. In a recent op-ed for the Wall Street Journal, Kennedy laid out his vision for how to rebuild confidence in this vital institution, which many Americans now view with skepticism and doubt. Kennedy argues that the erosion of trust in the CDC didn't happen overnight. Instead, it's the result of decades of growing bureaucracy, politicization of science, and what he calls mission creep, where the agency has strayed from its original purpose of protecting the public from infectious diseases. This gradual shift, he says, has led to a loss of focus and ultimately public faith. The COVID-19 pandemic, Kennedy points out, was a glaring example of the CDC's dysfunction. He criticizes the agency's policies during the crisis as irrational, highlighting measures such as mandating cloth masks for toddlers, enforcing arbitrary 6-foot social distancing rules, recommending boosters for healthy children, prolonged school closures, and lockdowns that devastated the economy. He also condemns the CDC for sidelining affordable, effective treatments in favor of experimental drugs that didn't deliver results. According to Kennedy, these missteps had a devastating impact on public health and trust. But here's where it gets controversial. Kennedy doesn't see these pandemic errors as isolated incidents. He insists that the CDC's failures are part of a broader pattern, pointing to troubling trends like declining life expectancy in the U.S. and a sharp drop in public confidence. For example, only about 1/3 of healthcare workers took the COVID booster in the 2023-24 season. And fewer than 10% of children under 12 received boosters in 2024-25. These numbers, Key argues, reflected deep skepticism about whether the CDC truly has Americans' best interests at heart. Kennedy also takes aim at the CDC's internal operations. He criticizes the agency for allocating only half of its budget to its core mission of infectious disease control, and notes that fewer than 10% of its employees are epidemiologists, experts crucial to managing public health crises. He links these shortcomings directly to the agency's poor pandemic response. Despite his sharp critiques, Kennedy remains optimistic. He points to the CDC's recent swift and science-driven response to a measles outbreak as proof that the agency can still perform effectively when it operates free from political influence, and Kennedy also highlights steps already taken by the Trump administration to address the CDC's problems, such as replacing resistant leadership and tackling conflicts of interest and bureaucratic inertia. These efforts, he says, are the beginning of a long process to restore transparency, honesty, and integrity to America's public health institutions. However, Kennedy's approach has sparked significant backlash. More than 1,000 current and former employees of the Department of Health and Human Services have called for his resignation, criticizing his recent firing of CDC Director Susan Monarez and accusing him of appointing political ideologues to key positions. This controversy deepens when considering that 9 former CDC directors and acting directors publicly condemned Kennedy's leadership in a New York Times essay. Is Kennedy's plan a necessary shakeup to restore the CDC's credibility, or does it risk politicizing an agency that should remain above the fray? This debate touches on fundamental questions about science, trust, and governance in public health. We invite you to share your thoughts and join the conversation below.